I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. Today we are going to talk about the Kouri Richins trial. So Thursday and Friday, Carmen, her former housekeeper, testified. And Thursday, so as a person that has a speech impediment and also a processing learning issue, when the defense brought up Carmen's learning disability, it immediately made her more sympathetic to me. I don't know that that happened to everybody. I think a lot of people in the chat, that just kind of felt like a low blow. And if they hadn't brought up, so the defense brought up her learning issue and then forced her to read and then pointed out the fact that she wanted somebody else to write the statement for her when we still don't know. So her learning disability could be dysgraphia. There's some people that struggle with writing out their thoughts, and it's severe, and writing is extremely taxing and difficult for them. But the defense was the one that brought this up, and then they were so confusing. Even the judge. Yeah. And Miss Carmen, so when that happened, Natalie Lawyer Chick did it. You'll also see if you go to Emily D. Baker's channel, because she has great tabs. So I think she went code green. I don't like she Emily D. Baker, she doesn't play. And so I'm pretty sure because Carmen becomes visibly upset. So she starts crying, and because I think initially she doesn't want to answer the question, and the judge has to encourage her to answer. And so she does answer it, and they ask her what type of learning disability she has, and she mentions that she didn't go far in school. And so that's where I wonder if she's been diagnosed with either so there could be some type of learning disability. She also started using drugs in the 6th grade. So using substance use also affects the way the brain works. Substances can also affect memory. And the defense was hamming her, and I understood. So the defense is doing what they're supposed to do. It just took way too long. It was 4 hours. She was cross-examined for 4 hours. I think the state's direct was maybe an hour and a half. I think. I don't know. The state's direct was maybe an hour and a half. She was cross-examined over things. So when the defense started again on Friday, they were going over some of the same things and some of the same statements that they had just went over. And then they have the nerve to not want the jury to be able to see all 7 of Carmen's prior statements. So the defense is up here well, this statement and this statement. And it was incredibly confusing for everybody. The judge was like, which one are we talking about? Is this refreshing her memory, or is this impeachment? It was confusing. it was extremely confusing. It was very painful to watch. But painful because the defense was making it confusing to me. Now, they could have also been confusing the jury. And when people are confused, that could introduce doubt. I've watched, so I feel like I normally agree with Emily D. Baker. I normally don't agree with Peter, which is fine. So the lawyer, I watched his video from this morning, and the defense did a good job challenging Carmen's credibility. And did Carmen's story change? Yes, but I believe her story changed as she was provided the digital evidence that went along. It was because let's say she went to that mart, her and Robbie, the schmugs, the person she got the pills from, if both of them are at the location 3 times, then that means that she met with him on those 3 dates. But does she have does she have that memory? But I think when provided with the digital evidence, it reminded her of what happened. And she seemed incredibly distraught that something that she might have provided to Kouri, that could have been the thing that harmed Eric. And that emotion felt real to me. And it didn't. So to me, I didn't feel like she was up there just trying to not be held accountable for her crimes, for what she's done. This incident might have helped her get sober. So, and she wasn't sober immediately. And the defense did a good job pointing out that she did test positive. Because I think she had said that she had been sober for 4 years, but maybe it doesn't equate exactly to 4. And with sobriety, like if somebody gets their dates off, so I work with people that are in recovery, and sometimes they do have difficulty remembering dates. I don't think she was being malicious about it. I didn't. I had a blast. So watching it with EDB helped me watch it. So if I was just watching it on court TV, that would have been way too painful. Like watching it, because Emily was saying the things that I was just like, and she was explaining, like, because at one point she says impeachment or recollection, and then she pressed play and the judge says, is this impeachment? And the judge says exactly what she said. And so and like I said, if you do watch with Emily D. Baker, she has the tabs done beautifully where you don't have to watch the entire 7-hour stream. And she also does recaps. She does like really short recaps as well. Because I think she has a video. I haven't watched it yet. It's the war of the two witnesses. Because Peter, the lawyer, he did like Robbie. And I didn't like Robbie. I thought he was being sketchy. So you could tell he didn't want to be there. Understandably, he is called by the state. He says that he's not using. He says that he's not, like, he says, he's not doing any of those things. To me, Carmen seemed changed, and it could have been my own bias. Okay. So I don't know. I really had a lot of, when we talk about likability and credibility. So did Carmen say everything exact? But I think the defense was confusing her. And at some point she was just like, yes. And sometimes, and I hate it when witnesses do that, because sometimes they're just so exhausted and they're just like, they just say like, yeah, like whatever you just said, like, just yes. I just want to get off the stand. What do I need to say to get off the stand? Everybody was probably exhausted. I felt like the same thing happened in the Devin Michaels trial with her stepson husband, with his testimony. He was getting confused with the defense cross-examination, and at some point he was just agreeing with everything, and I don't think he was really agreeing. I think he just didn't want to be on the stand anymore. Those are my own personal thoughts. I don't know that for sure. I have been on the stand, and it is difficult to be on the stand. But yeah, to me, Robbie, the person that Carmen alleges that she purchased the Fint from, and so I can't say certain words on YouTube, y'all can, but Anal is what it ends with. The person that she says she purchased that from, he says that he wasn't selling it at that time. He's saying, but also if there were any deaths in that time frame, if he was selling it at that time, because he says he was selling it later in 2022, but he wasn't selling it at that time. And I thought what I heard when he was on the stand is that the Roxy's and Fint, that they look the same, that they both were blue stamped with 30, and that they both look the same. And so maybe he thought he got, but I don't. So I was just all confused, because we know that there was the only substances based on the toxicology report, there was a high dose of Fint and so that the body had started processing some of the fent. There was neurofent, and there was no THC, so it definitely wasn't a gummy. And so it was a lot. I think with Robbie being on the stand, the defense clarified what the Michael Jackson drug was. And I thought that was a bad idea. Y'all let me know in the chat, because I don't think anybody had talked about is it prohypnol? I don't, the substance, the very strong sedative that allegedly Michael Jackson became addicted to, and that's what led to his death. Because Anna, the woman whose boyfriend died in a motorcycle accident, and she was just there because she overheard the conversation, and she overheard the Michael Jackson drug part. The defense clarified through Robbie that it was propofol, and that killed him. And so if Kouri's looking for the Michael Jackson drug, is she looking for something that can kill her husband? Like, that's what I would be thinking. But like, I don't think anybody else had said what the Michael Jackson drug was. But like through Robbie, and the defense asked the question. The defense asked about the Michael Jackson drug. And I was like, what in the world? So with the Seroquel, I wonder, because I think it was a low dose of Seroquel. I wonder if she had been putting something in, like, a small bits in his. I don't know for sure. I don't think he was taking it on his own. Seroquel can make a person sleepy. And when somebody is having an affair, they often don't want to be intimate with their partner. And Seroquel often makes people sleepy. So I was wondering if she had been giving, I don't know. So that's where I don't know for sure, but but she's the one that had the prescription for the Seroquel. There wasn't a therapeutic dose, so there wasn't an amount that a person would have been prescribed, but there was like a low amount of that. And I love the way EDB said it. I can't say it. Oh, wait a minute. Thank you for adding this. So was the carrier for the Fent? I don't know. Yes, Robbie got immunity. He got 3 deals of immunity, and they'll have to determine if his testimony was truthful. So he's saying after he got sober, he then remembered that, like, what he said in his interview, that it wasn't accurate, and that now that he's sober, he now remembers that he never sold that. But I think he doesn't want to be tied so this trial is huge. Does he want to be tied as the dealer, even if he's not prosecuted legally? I wonder if the family could still come after him civilly. Like, could he still be financially responsible? I don't know. So I feel like, I don't know if Robbie was telling the truth. Of all the people, I feel like Robbie, he came across sketchy to me, and I don't know if that's a bias. Do you know what I mean? Carmen, I believed her more. He did not come off credible to me at all. He didn't come across credible to me. So somebody mentioned being in recovery and memories did not come back when they got clean. Like, his testimony, I had questions. I didn't think it was completely forthright, and that I had questions. Carmen came across way more likable. At one point, she lets the defense know, because the defense keeps asking, did Kouri ask for Fent? And the answer to that is no. But Carmen, so you have to wait for redirect. Carmen should have just said no. But Carmen on her own was like, I told Kouri Robbie had Fent, and she said to get it. So did she ask for it specifically? No, but I told her that's what he had, and that's what I got. The I wish the detectives or the police officers in the case hadn't said for Carmen, like what they want out of Carmen's interview is to be able to lock Kouri up for life. I wish they hadn't said that. It makes things look more suspicious. I wish they hadn't said it. It could make somebody on the jury a little bit more like question her testimony more. I don't think the state's case is solely on the, like, I feel like they have more evidence. The memes Kouri searched that day of her husband's death, and then all of that other evidence that they have with the affair, I can't get over the trip that Kouri had booked with her lover, 5 months. Like, but like, if her husband was alive, how was she going on this trip with her lover? And so I'm waiting for some of that information to come in. Somebody mentioned that Robbie's lawyer wouldn't come into the courtroom. And then Karen, and that's fine. And so we can disagree, and that's fine. Karen says, I don't believe Carmen. I think she was keeping some of the tablets. Okay, she might have been. He said 30 tablets wouldn't fit in a button-sized baggie. Okay. And I don't think she was using that. I don't think that was her drug of choice. I don't know. It could have been. I don't know. And Carmen could have kept some of the money for herself, because he says that it was maybe not, but I think there's more evidence to come, and I'm waiting to see how everything falls together. I think the way the defense handled cross-examination with Carmen, and then they were so kind to Robbie. So Robbie did not write his statement. I think the defense typed it for him. And that was not an issue. But when Carmen asked to have her statement written, the defense made a big deal about that. But once again, they're the ones that pointed out her learning disability, and that seemed unfair to me personally. Like, that's just, but that strategy could end up hurting Kouri, because if the jurors, and now it shouldn't happen, because like, if the jurors don't like the attorney, that should not affect how they feel about the client, the defendant, but sometimes it can. And so if the lawyer is also coming off unlikable, or like they're bullying a witness, and she wasn't. So it didn't cross the line of badgering a witness. To me, it was close. It was just knowing that Carmen didn't have, like, that she has a learning disability. She has difficulty remembering things, but that cross could have been 2 hours, and like, just, you don't remember. You're saying that you remember things better now. You had to be provided with the information. It was guided. They were kind of encouraging you what to say. Like, I feel like it could have been smoother. It was very clunky. So I'm bad with like names and dates and things. But if I was a lawyer, I would make sure that that information was accurate. The lawyer kept making mistakes that was confusing the jury. At one point, the defense lawyer asked Carmen, she's like, "Oh yeah, and you sold the pills to Carmen?" And Carmen's like, "I'm Carmen." It reminded me during the Donna Adelson, I think it was Donna Adelson's trial, where the defense lawyer called one of the witnesses, like, the defense lawyer forgot his, I don't know, like, mentioned his name, and so it was a thing. And I liked watching Natalie Lawyer Chick's coverage of this. I believe she's going to have a part 2 to her video. I wonder how she'll feel after this goes on for on and on and on, because it was a very, very long cross, and it felt like too long. Just felt like it was just way, way, way too much. Way, way, way too much. Yes, Garcia. Yes, Jackie Fulford. Jackie Fulford. And to me, Garcia, in the Donna Adelson case, even though he was a convicted Like he's done a whole bunch of crimes. He came across credible to me. He just did. And while everything Carmen said might have not been 100%, she might have forgot things, she might have misstated things. Um Looking back, Carmen likely thinks that Kouri did the thing, that Kouri did it. And but I don't know. It was hard. Hey Phoenix, I don't think it's about liking the defense. As a spectator, potential juror, I would feel like they were trying to gaslight me. Yes. That makes me feel like they don't have a good fight. Yeah, it didn't seem fair. Like it went on and on and on. And she could be called back because I believe she hasn't been fully released from her subpoena yet, and she's not allowed to watch the trial or any coverage. And so they could potentially call her back again. I do wish her and Robbie all the best in their sobriety. Also, Anna too, because I think Anna is in recovery as well. And so I hope that they both that all three of them continue on their journeys, that they make good decisions, all those good things. Yeah. Do you think that the jury approved of the way the defense attorney cross-examined Carmen? I don't think Kouri approved. Kouri, because it was confusing. And if you like it was incredibly confusing. And there were times when Carmen was like, that's not what it says. Because she's like, it says this. And she's like, that's not what it says. And they would get into little tiffs. And I didn't love that the defense made the statement that the prosecution is going to determine whether she told the truth or not. And it's not going to be up to the state. It's going to be up to the judge. So I didn't like that some things were misstated. The state also said, sorry, if I said, I meant defense, that the defense said that it was going to be up to the state to determine whether she was truthful or not. And then that the defense also said that she was facing like 20 years or life in prison or something. And it was 7 years. Natalie Lawyer Chick looked up the law of what because like that doesn't sound right for a first offense. Like Natalie Lawyer Chick was like, that seems wrong. And so the defense said things that weren't accurate. And I wonder if the state is watching the jury, and because they didn't correct any of those things. It was a whole lot. It was a whole lot. In my opinion, what you gonna do about the texts from Kouri and Carmen? Luis Rivera, that's my bad. But the one who testified in Luis. If I said it wrong. Yeah, because Garcia, it wasn't Garcia. But she said his name wrong. Like I think she combined the wrong names. Y'all know I'm bad with names. It's not my case, not my trial. Yes. Thank you. Thank you for correcting that. Do you think Kouri should be required? Sarah. All right. Let me know if y'all have any general questions. I'm going to look through my notes again on this. She worked for Kouri for 9 years on and off, that she would clean the house. She would clean properties. She says that she purchased illicit substances for Kouri. She deleted texts because she didn't want to be caught. And she reached out to a friend on Facebook Messenger to see if they could get what Kouri was looking for. And then Carmen said, in the early stages of addiction, you test the waters to see what you can get away with. And so it did to me seem like Carmen was on a positive path for recovery. The defense pointed out the fact that she hasn't been tested. That is what it is. She could have moved to Las Vegas, but she's decided to stay in Utah for now. I wonder if she was waiting until this trial is completely done before she relocates, but it'll be her decision. Could have a lot to do with other things. It also got confusing back and forth between Carmen and the defense of like, you can't do this. And Carmen was like, yes, I can. And they're like, but it says right here that you can't do it. And it's like, and even the judge had to be, her understanding was that she could. Like, oh, I don't know what to tell you. It was, but even Kouri seemed, so Kouri, her facial expressions were not as muted when they panned to her this time. Because for the other testimony, her face had been pretty calm, just straight face, no real reactions. She did her like grin a few times. And that time, like she sometimes like has this look. I'm so glad. That's why I don't do crimes, because you can see what I'm thinking on my face. You really can. And so this is the trial we all, oh wait, let me see. Did you see Kouri's neck movement and eye intimidation? So I missed that part because I sometimes listen. I'm not always watching everything. Somebody else caught that too. That so some people thought that Kouri was kind of when Carmen was on the stand, it definitely seemed like this was a witness that Kouri was nervous about. I agree. Kouri seemed mad. But the longer you keep her on the stand, the more you see Kouri's reactions. Now, the defense isn't going to know that because they're sitting right next to her. They're not going to know that. But it was a lot. What do you think of defendant throwing a big tiff over the mental diagnosis of mental health issues with Carmen, saying no until she said anxiety? To me, I associate that more with symptom than diagnosis. And so that's where, so if Carmen is not currently in therapy, so there's a level of anxiety that's no longer clinical. And if she had been on substances since sixth grade, and I believe she's in her mid 50s, so she had been on substances for all that time. Sometimes people use substances to cope. And when you stop using, it would be really common to experience anxiety, depression. I wouldn't be surprised if there was a history of some type of like trauma or something. I don't know that for sure. It just wouldn't surprise me. And for a mental health issue to be diagnosed, it has to be impairing functioning. So I have anxiety. At today, it's not clinical. Has it been clinical in the past? Yes. If I were to go to outpatient therapy, they would probably diagnose me with an adjustment disorder first, maybe generalized anxiety. I think there might have been past records, because sometimes with drug court, sometimes there might have been a mental health diagnosis. I don't know. Because in the past, she might have been diagnosed with substance use or dependence. She could have been diagnosed with something like that. If she's no longer in treatment, if she's worked through all of those things, those diagnoses would fall off. And so and this was her understanding of what her diagnosis is. Because there have been people that have come into my office and they're like, I'm in outpatient therapy. I don't have a diagnosis. And I'm like, are you paying out of pocket? And they're like, nope. I'm like, your therapist has diagnosed you with something. And so sometimes people aren't always aware of what their diagnosis is. And so if you are in outpatient therapy and you're using your insurance, your therapist has to bill a diagnosis. They have to. If you don't have a diagnosis, then you have to pay out of pocket. So for coping therapy, so if somebody just like wants to go to therapy just to better themselves and they're doing great, but they just want a general check-in, they would have to pay out of pocket. Right? Insurance only pays for what's medically necessary. and people aren't always aware of what their diagnosis is. Do we all have anxiety? So anxiety is normal. So um too little anxiety. So a little bit of anxiety can motivate you to do things. A little bit of anxiety can make sure that you're on time. A little bit of anxiety can encourage you to study, or it can motivate you to do things. Too much anxiety can be debilitating. So too much anxiety can cause panic attacks, can cause um, overwhelm, exhaustion, burnout. Too much anxiety can be unmanageable. So anxiety has to be managed. Anxiety will never be at zero unless you take a Xanax, and I don't. So I don't. I try, if my clients have significant anxiety, I try to see if they can use other skills and things and not be reliant on medication if they can. If they do need medication for a period of time, but I try to see if they can use other strategies first, because those really strong medications that just zonk a person out, they can be addictive, and they can also, it can kind of disconnect the person in a way where they don't learn how to manage things. Now, if somebody is coming out of a major crisis or like a major stressor or trauma and they can't sleep, like they're just, things are overwhelming. Sometimes that's a short term solution, but it's just not a long term one. So when clients are on medication for anxiety, they're typically prescribed an SSRI, an MAO, like something that they're going to take over time, something that can be like it builds up in the system and it comes out. Versus those short acting ones. There's also something called hydroxyzine. I'm not a medication specialist. This is not medical advice. Okay. But that I've had lots of clients that are prescribed that as needed. If they do have high levels of anxiety, it can make a person sleepy. And so that's where people have to be careful with that one. Cymbalta, I need to search. I believe it is. Yes. SNRI. So Cymbalta is an SNRI. Okay. Used for anxiety and depression. It's a selective serotonin neuroepinephrine reuptake inhibitor. So SSRIs are selective serotonin reuptake inhibitors. SSNRIs add the neuroepinephrine. And so what that does is it tries to keep those happy chemicals in the brain. Okay. It tries to block so those things aren't getting sucked out and that people have appropriate levels. Medications can cause side effects, they can cause issues, and that's where people consult with their medical doctor, talk with people about all those things. Does dressing, ooh, okay, so does dressing accused as a 7-year-old girl going to ballet really help? I don't know that. I've never heard that before. What about her covering her face during the whole body cam? So I did a whole video. So go, if you click on my live videos, me and Paul, I did a whole video talking about Kouri and the body cam footage. This is my third video since trial started talking about Kouri. I think she was hiding her reactions and hiding her face. There were times, because the body cam wasn't always showing her entire body, because there are a few times when you do see her hands down by her side. But for most of the video, she was covering her face. The officer noticed that as well. And that's super suspicious to me personally. But yeah. Yep. All right. Let me know if you all have any general questions. Thank you to everybody that is a member. I try to make most, if not all, of my content accessible. There are people that pay for memberships, and so I do provide them exclusive content. And if there was a members only video that you wanted to be able to see, just so like I try to be really flexible, but it would be on a topic. It wouldn't be like a general Q&A, because anybody can ask a general question in the regular comments, and sometimes I will reply with a video and things like that. Yes, so I'm a psychologist. I'm not a psychiatrist. In Virginia, we do not have, so psychologists do not have the ability to prescribe. There are states where psychologists do. Even if I couldn't prescribe, I wouldn't want to, because you have to do medication shit. Like, it's just a whole big liability. I wouldn't want to. I like being able to refer somebody to a psychiatrist. I also take a whole body approach. So with clients, I encourage them to get a physical, to get their levels checked, because sometimes when you meet with a psychiatrist, but you haven't met with your regular doctor, or they haven't done labs in years, your iron levels. So there are physical conditions that can mimic psychiatric issues. So hyperthyroidism can look almost like bipolar disorder or ADHD. Hypothyroidism can look like depression. I think hyperthyroidism can sometimes present as anxiety. Low iron can present as depression. Low vitamin D can present as depression. So there are physical things that can impact mental health, and addressing the whole person. Physical activity is a natural way to build serotonin, epinephrine, and all of those positive, good chemicals. And so, but there are some people that biologically medications just help. And that does not work for everybody. I've worked with a lot of people, and there is no pill for hard life problem. So my mom is the most important, like my mom, not most important because of my husband, my child. My mom is really, really important to me. When she is no longer on this earth with me, I will be in therapy. So I will, I don't know if I'll need medication, but like if I would be open to it if I need, but there's no medication to cope with grief, like completely. Like you have to move through grief. Grief is something, and trying to not feel makes things worse. Traumatic grief, it all comes on too much, too fast. And that's where having a therapist immediately can be really, really helpful. Yeah. Yes, walking. So getting outdoors, so getting sunlight. I work with some clients that keep their homes really, really dark and they're really, really depressed. And it's like, open some windows, like get some physical light. Go outside for 5 minutes a day, 10 minutes a day, 15 minutes. And then seasonal depression is real. We are now getting more sun. Next week, we lose an hour, but we get some more sunlight. So that will happen next week. And all of those things are really important. Kouri kept saying the pain pills were for a client. Will that person testify? They weren't for a client, I don't think, but is she going to say who they were for? I don't think they were for a client. I could be wrong. Is she going to have somebody that can say that? I don't think the defense is going to try to find that person. So it would be on the state to prove that it wasn't that. I don't know that the defense would have to provide who that was. I don't know. EMDR. Y'all know I was recently trained in EMDR. The loss of a child, there are no words. And so I wish you the best on your journey, on your process. Healing is not just like better, better, better. Healing is a roller coaster. And take it 1 second at a time, 1 minute at a time, 1 day, 1 millisecond, like just keep going. And I am so glad that each and every one of you are here. Okay. And so healing is possible. And if people, and there is help available. So in every video, I have treatment resources. So Psychology Today. I might have Open Path Collective that's free or reduced. They're not free or reduced. But there is therapy. So I love sarcasm. You never have to apologize for it. Only if people like don't understand. So and sometimes if you put like sarcasm, but hopefully people understand, I am an incredibly sarcastic person as well. Okay. I once went on a first date with a guy, and and like 5 minutes in, he was just like, I don't do sarcasm. And I was just like, oh, and the rest of the few hours was just painful. I just wanted to, like that was the end of it. That was absolutely the end of it. And so doing the opposite of depression is actually helpful. Doing what depression wants will keep you more depressed. Doing what anxiety wants will, like, if you listen to only anxiety, so anxiety will have you like never leave your house. Anxiety will have you feeling that everything is, I don't know, like, and like anxiety will just have things revved up and it'll have you focusing on things that are out of your control. The serenity prayer is something that I actively practice. Um, Letting go of those things that I cannot control, doing what I can. So I do what I can. I let go of the things that I can't, and I focus on what is in my hands. And sometimes they're just little things. So when people are severely depressed, sometimes, and if they don't have the energy to brush their teeth, I will sometimes encourage them to just get those like whisk. I don't know, like there are those where you don't even have to wet it, like your spit from your mouth can like brush. We start where they are and we slowly get there. Telehealth has been really helpful. So a lot of clients that I work with, if they had to come to my office, I would never work with them, just because leaving the house can be incredibly difficult. And so telehealth can sometimes be helpful. Some people hate online sessions and they need to come in person. And so uh, why do you prefer EMDR over CPT? So I'm trained in cognitive behavior therapy. So what does CPT stand for? Do you mean CBT, cognitive behavior therapy? Let me know which one you mean. So, and other types of exposure therapy. So what EMDR is, it's a process. It is a multiple step system, but once you get into trauma processing, what you do is you have the person focus on the worst part, and then we use eye movements or tapping. We use something to reprocess the information. And there is a subconscious part of EMDR that I like, because when a person is just verbally processing or just verbally exposing themselves, sometimes they're not stopping and fully processing. EMDR has you sit with the emotion, have you sit with it, but the eye movements helps it be a little bit more tolerable. And so I've seen more success with that cognitive processing therapy. So I do have some clients that prefer to process. There is a processing component to EMDR, but there's also a part of it where the person is sitting in the emotion. I've had some people in processing where I have to stop them and we have to reorient, or things kind of, and with EMDR, I find that we're able to keep things more contained. And I've personally enjoyed it. Yes. So, it's something that I've enjoyed. And so cognitive processing therapy, that's just, I normally do that as part of cognitive behavior therapy or trauma-focused cognitive behavior therapy. Cognitive processing, it's yeah, and so, yeah. So, and each person finds what works best for them. There are people that have had bad experiences with EMDR. There are people that have had good experiences. So each person finds what works best for them. I had a friend that actually was harming. Okay, wait a minute. So I can't give individual advice. So I am a psychologist. I am not anyone. So I can't give individual advice. I will say in general, and that's where if somebody has a therapist, if they have supportive people in their lives that know more about their situation, they can be supportive. Um, yes. All right. And so with Kouri, we'll see what comes up next week. I'm excited for them to get into, because with the last witness on Friday, it seems like they might be going into some of the digital evidence. We will see. There are multiple phones. There are phone extractions. I'd be interested. So I'm just waiting to see some of that. I feel like digital evidence is what DNA evidence was in like the 90s, where everybody was like, if they had DNA, people were getting convicted. The digital evidence I think can be really telling, and so I like that. And if people do like more general processing, not processing, if they like, so I have a playlist called Therapeutic Resources, and so those are just on different mental health topics. So most of the videos I do here now are focused on a clinical trial. No, not clinical. It's focused on a trial, covering a trial, that psychology and legal aspect. When I first started my channel, I thought I was going to be just like psychoeducation. I thought I was just going to be an educational channel. And those videos normally don't do as well, but they're still there. I really enjoy doing those. I really like providing that education. And so, if there is a topic that's not covered, and if you have any recommendations, putting them in the regular comments, I do take a look at those. All right. And so, I appreciate you all. We're about to start the members only video. I so appreciate each and every one of you. We will see what happens next week. I will be live on Tuesday. I can't believe it's already March tomorrow. I hope y'all had a great February. I will see you all next time. Have a good one. Bye.